Healthcare reform has been in the development for many years. When President Obama got elected, healthcare reform was one of his first priorities to get in motion. It took 2 years after his election to get the bill passed through the House and Senate. It was officially approved and signed into law on March 23, 2010. It quickly went to the Supreme Court to judicial review. On June 28, 2012, the Supreme Court held the constitutionality of the Affordable Care Act after a long process, and still some glitches. Coverage took effect on January 1, 2014. Enrollment lasted 6 months and will close on March 31, 2014. The whole idea of ACA is to make health insurance affordable for a very large amount of uninsured citizens. There are 3 different kinds of plans: the Platinum, Gold, Silver, and Bronze. The costs of each are found through a number of variables, including age, location, and family size. Platinum and Gold are more expensive because more benefits are offered and less out-of-pocket expenses are incurred. The different plans offer more options for people when signing up.
We've outlined a few of the conditions of the Affordable Care Act and examined the unintended consequences of those conditions. Before the ACA, insurance companies were allowed to charge higher premiums if a person was female or had a pre-existing condition, such as diabetes, asthma, high blood pressure, or heart disease. Companies charged higher premiums for these patients because they have a higher risk, meaning they are more likely to experience health problems that require care. Women often require more care in the eyes of insurance companies because of things like pregnancy and annual preventative exams. However, the insurance companies need to generate this money to cover the expenses somewhere. And they can't charge individuals more money for a plan, but they can charge more overall. Generally speaking, with the ACA, the cost of health insurance has risen. Another condition is that starting in 2015, businesses with 100 or more employees are required to provide insurance to their full-time employees. This seems like a great and logical idea. However, the cost of providing that insurance is just too high for many employers. To be able to cope with this request, businesses have begun laying workers off so that they can reduce their overall amount of full-time workers who require insurance.
There's been a lot of conversation, a lot of news headlines about hospital stories in the news of late, hospitals being sold and consolidated. Now big layoffs this week, 129 pink slips at Liberty Hospital, and they're being blamed, according to news reports, on Obamacare. Liberty Hospital forced to reduce expenses by $20 million. Devastated employees, including nurses and some senior managers, left the hospital in tears this week after being told to collect their belongings. But why?
So as you can see, layoffs are real and are happening. Another way to reduce costs is to reduce the hours of some employees to below the full-time threshold of 30 hours. Companies such as SeaWorld, Wendy's, and Subway recently reported that they would be reducing many of their employees' weekly hours to below 30, therefore reducing their overall number of employees who require insurance. Another issue with this new demand is that because of the monetary issue now faced by the company, they will have less money to spend on other business improvements, thus preventing the business from growing. In addition, employers such as UPS and even institutions such as the University of Virginia have stated that they will no longer be able to carry the spouses of their employees on the provided plans. The overall cost of the new premiums, coupled with the 30-hour full-time requirement, has rendered many businesses unable to fully provide for their employees and their spouses. The ACA presents new financial difficulties that for some businesses will prove insurmountable. Another condition of the Affordable Care Act is that Medicaid has been expanded to cover more people. This means that it will cover people aged 19 to 65 whose income is below 138% of the poverty level. This federal aid is great for those who need coverage but cannot afford it. However, many researchers predict that because under a certain income citizens will be eligible for free or government discounted health care, they are likely to work less or even quit their jobs. This will lead to rising unemployment and will negatively affect the economy. Another issue with the expansion of Medicaid are the doctors we rely on to treat these patients. Because Medicaid is a government-run provider, they can choose what doctors will be paid for a service. Casey. This means that if a doctor bills $500 for the treatment of a Medicaid-covered patient, Medicaid can then respond with a price they are willing to pay, say $300. This means that there is a $200 difference between what the service cost to the doctor and the amount he was reimbursed. This money has to come from somewhere, and it unfortunately comes out of the doctor's pockets. More and more primary care doctors will be saying no to Medicaid recipients, leaving more and more people to either go to emergency rooms for care or face extended periods of time trying to find a doctor who will accept their form of insurance. These are essentially the same problems the system had before. Another issue with the expansion of Medicaid is that more young people can be covered. And because they are covered by Medicaid, they do not need to purchase insurance, which the Affordable Care Act relies on. Less money from the young and healthy means less money for the old and sick.
Under ACA, elderly are supposed to be better cared for and have better coverage. However, the elderly generally have more health issues which are expensive. In order to lower costs for the elderly and still incur those expenses, prices must be increased for others. Young adults will be affected mostly by this. This cost for young adults has increased. The plan was to offset the cost of the elderly by signing up many young adults who do not cost nearly as much. However, many young adults are seeing the increase in price and choosing not to sign up. This in a way contradicts the point of ACA. Young adults can stay on the parents' plan until they're 26. This is a new requirement of ACA. This was a relief to hear from many young adults in their 20s. For those who are on their parents' plan, do not need to worry about getting coverage until 26. However, once that person does turn 26, they may not be willing to buy a plan and therefore either go on Medicaid or get a fine. Either way, the system does not work well if young adults do not sign up. As we said previously, many jobs will be lost and hours cut, which is never good for the economy. In the long run, this could raise unemployment and reduce spending. This could hurt the economy because if people are not putting money back into the economy, it could slow the economy down. However, jobs are also being created. With the expansion of the healthcare system comes the need for new jobs. Jobs in health education, IRS, insurance jobs, and healthcare in general are. The Affordable Care Act was a good idea, and everybody should have the right to healthcare. ACA has the right intentions, however, there are a large amount of consequences that could hurt the program. One of the biggest economic consequences that we deduced from our research was the problem of economic freedom. A part of economic freedom is the ability to start a business. Many businesses will be bogged down by payments now. This will reduce people's initiative to start a business. With even more expenses to worry about, people may not be able to enter the business. This factor will reduce our economic freedom.
We've only just scratched the surface of the Affordable Care Act. However, the unintended consequences are surely going to have a large impact on American society. Thanks for listening.